rapid access to comprehensive oncology data and survival analysis. This is the OncoToolkit.
Hi everyone, today I saw a patient who had recently undergone surgery for a soft tissue sarcoma. The pathology report described an intermediate level of differentiation, an increased mitotic count, and limited tumor necrosis. The patient wanted to know, "Doctor, what grade is my tumor?" Rather than interpreting each feature separately, let's take a closer look. Our patient is a 56-year-old woman with an adequately sampled adult soft tissue sarcoma. The pathology assessment assigns a differentiation score of 2. The corrected mitotic count is between 10 and 19 mitoses per 10 high-power fields. Tumor necrosis is present but involves less than 50% of the tumor. Let's assess this case using the FNCLCC Grade calculator in the OncoToolkit. The FNCLRC system assigns a histologic grade using 3 pathology components: tumor differentiation, corrected mitotic count, and tumor necrosis. Let's enter our patient's findings. First, we'll select the tumor differentiation category. The pathologist assigned a differentiation score of 2, so we'll select the option corresponding to score 2. Next is the corrected mitotic count. The tumor shows between 10 and 19 mitoses per 10 high-power fields, so we'll select the mitotic score of 2. Finally, we'll enter the extent of tumor necrosis. Necrosis involves less than 50% of the tumor, so we'll select the necrosis score of 1. Now, click Calculate Score. Here are the results. The patient's total FNCLCC score is 5, corresponding to FNCLCC Grade 2. The score is calculated by adding the 3 components: 2 points for tumor differentiation, 2 points for the corrected mitotic count, and 1 point for tumor necrosis. This gives a total score of 5. A total score of 2 to 3 corresponds to Grade 1, a score of 4 to 5 corresponds to Grade 2, and a score of 6 to 8 corresponds to Grade 3. For this patient, the final result is Grade 2. You can click Copy Result to copy the assessment. To save it, enter the patient's name and click Save. Previously saved assessments can be viewed from the Saved Results panel on the right-hand side. The Clinical Workflow section also provides guidance on appropriate use and interpretation. The FNCLCC grade should be based on representative pathology material and a histologic subtype for which this grading system is applicable. It is a histologic grade, not an AJCC stage, individualized prognosis, or treatment recommendation. The result should always be interpreted together with the tumor subtype, size, depth, location, margins, imaging, and specialist sarcoma review. If you'd like to learn more, scroll down to the reference data below. Here you can review how the total score maps to FNCLCC grades 1, 2, and 3. The calculator provides a structured way to combine differentiation, mitotic activity, and tumor necrosis into a single histologic grade. For more oncology calculators and clinical decision support tools, explore the OncoToolkit.